When we start talking about trauma-informed treatment, people are often wanting me to teach them about particular magic bullets or evidence-based practices. Now, what I'm going to talk about now are the underlying principles of treatment. And actually, these principles apply to any treatment, but are especially important to treating people who are experienced trauma. There are many different evidence-based practices for treating people who've experienced trauma. And your agencies may be using some of them. You may be trained in some through your placements. You may have already experienced some. And of course, which evidence-based treatment is being used depends partly on the population. Some are designed for children, some specifically for parents or parents of young children. The trauma-focused cognitive behavioral therapy is one that is especially evidence-based and especially popular in Connecticut. A lot of places use it. And then another one that's very excellent is called Circles of Security, which is designed for parents of young children, but has been used for all ages of parents of all age children, and really is based on attachment and trauma principles. But there's many more. All of these interventions are based on some basic understanding of what trauma is, how it affects us, how it relates to current behaviors, and what helps people heal. And if you don't understand those underlying principles, you can't really do the evidence-based treatment very well. So that's what we're talking about today, these underlying principles. So the most fundamental principle of trauma-informed care is that the tool that you have that has the most power and that is the agent of change is the relationship. And the relationship is so important because people have been hurt within relationships, so they heal within relationships. Plus, human beings grow and their brains change through relationships. It's through relationships our brains develop and grow as babies and children, and it's also through relationships that they grow at any age. Remember, we talked about attunement and that kind of connection between two people where they're paying attention to each other and reacting based on what the other one does. Well, that kind of attunement is how brains are built in the beginning, but it's also how brains are built at any stage of life. And as we know, and as we talked about when we talked about the effects of trauma, people who've experienced trauma have formed views of relationships that lead them to believe that relationships will hurt you, that people cannot be trusted, that they disappear, that they hurt you, that they're angry, that they don't recognize your needs and meet them. All of these things are part of what a person who's experienced trauma expects. And it is also relevant how they are going to feel about relationships. It's also relevant what type of trauma they experienced and how old they were. So what happened to a baby versus what happened to a 2-year-old versus what happened to a 10-year-old, all of someone differently. But they do all affect the person's ability to trust others. And furthermore, remember what we talked about shame. Shame is a very central concept in trauma-informed care. What does shame mean? Does anyone remember what shame meant and how it differed from guilt? Does anyone remember that? What is shame and how does it differ from guilt?
Well, I believe guilt was you're a good person who made a mistake, whereas shame, like the mistake is a reflection of the person and it becomes more like intrinsically like they are the mistake.
Exactly, right. So people who've experienced, thank you, Carolyn, people who've experienced trauma believe that everything that has happened to them is their own fault because they're no good. And so if a person deeply feels in their heart that they are no good, that they're different and worse than other people, relationships are going to be very hard for them to form. They believe another person gets to know them well, that person will hate them. The more that if I'm shame based, the more that you get to know me, the more you'll see how horrible I really am. And then, of course, you'll leave me. So let's skip that whole step and not get to know you at all, not get to like you at all. I just expect that if I do let my guard down, that you will end up taking advantage of me, hurting me, leaving me. I build an armor because I believe people are the sources of hurt. I build an armor. And what actually is very scary is when there's cracks in that armor. When I begin to believe that maybe you're okay, maybe I could trust you, that's scary because to me, that feels like I'm setting myself up for disappointment. In order to understand this, we can remember a couple things. One being what we talked about, the grocery store, and what our experience is when we think other people are going to kill us. And another thing you can remember any time when someone has hurt you and your reaction is to harden your heart. An example might be someone who was badly treated by a friend and then meets a nice new person but is very reluctant to get to know them because of what they've just been through. If we can take experiences like that in ourselves and just remember how it feels, that will help us to understand how hard it is to form relationships when you've been hurt. So it's our job to be the trustworthy person, to be the person that can help that trauma survivor to learn that not everyone hurts you, and to learn that people can be good, people can be helpful, people can be honest and trustworthy. That takes patience on our part. We really can't expect that we're going to have a nice conversation with somebody and then after that they're going to trust us. It's going to take many repetitions, time, and then there's testing. As I mentioned, beginning to trust someone can be very, very scary for someone who's been hurt. So if, let's just say you and a client had a really good time together, you were really clicking, you and maybe had some fun together, laughs, good talk, you think, wow, we're really getting somewhere. I'm feeling like I'm really connecting with this person. The person, on the other hand, is terrified. And then the next time you see them might be really mean to you or refuse to talk to you or something like that because they felt that connection and it scared them to death. It's scared because they could feel those cracks in their armor, and that's where danger can come in. So that's where your patience comes in, that you hang in there. Even though the person that you just had a nice time with now is being mean to you, you stay steady. And then after a while, that person tests you a little bit more, and discovers that you stay steady. Then that's when a real bond will form and when the person will really be able to change. So what are some of the ways that things we can do to enhance this relationship or to form it? One is looking at the person as a whole person, not just their symptoms or their problems. So when you get to know them, it doesn't just mean get to know what they're upset about, and what are their triggers and all that kind of stuff. It means get to know what's their favorite color, did they have a pet, what do they enjoy doing. Don't underestimate chit chat. Getting to know someone is much like getting to know someone in any other aspect of your life. Remember, a lot of times we go too fast wanting someone to talk right away about their problems or things that are probably the most shameful and distressing things about themselves. Would you do that with a stranger? Would you be happy if a stranger said, "Hi, nice to meet you. Now, what was the worst thing you ever did?" You go slowly, discover commonalities between you and that client. And this doesn't mean that you tell the client that your parents got divorced when you were 10. It means commonalities like you both like the same singer or something like that. And we're going to go more into this part about explore, don't change. You be real, be truthful, be honest, be who you really are. Don't rush, be trustworthy. And our trustworthiness, we could all sit here and say, of course, we'll be trustworthy to our clients. But actually, it can be quite a challenge to be trustworthy because you may have an appointment with a client and then a big crisis comes up with another client. So you have to break the appointment with the first client. You may say you're going to do something and then circumstances happen and you don't do it, etc. So it doesn't, however, mean be perfect. It means that when you do have to go back on a promise, well, first of all, be careful what you promise. Don't promise much. If you do have to go back on a promise, that you're honest about it, you apologize, you explain it briefly, and you do what you can to make it up. That laughing is a great way to make a relationship, little jokes. And then remembering that our primary job as a helper is to stand beside someone, to be their witness, to be able to be with them in the pain of their life. Now, I'm saying this, you might think, oh, sure, sure. That is very difficult. It means that you have to feel the pain of their life. It's a very, very tempting to jump in and try to fix it. They have a lot of people trying to fix them, as do you, as does everyone. What they don't have is someone who will stand beside them and say, tell me more. How is this for you? And just validate. That's where your power is. So these are some ways to form a relationship. There's many more. Does anybody have any comments on this task of forming relationships with people who've experienced? Have you had any experience trying to do this? It's not always easy.
So a lot of the students that I work with have behavioral challenges, and others have developmental challenges. I can think of a particular student who I've built a relationship with, and honestly, the way that I found that my students are more likely to build a relationship with me is because they present as heavily guarded,
Yeah.
Resistant and aggressive, especially when they're tantruming or having that like impulsive outburst behaviors. So what I find is that being in that moment with them and riding that wave and just being there to reassure them and just to show them like I'm not going to leave you, and being in those behaviors and being consistently there, I feel like I've established a relationship filled with trust, and just mutual respect with my students. Just being in those behaviors with them and like being fair and not leaving and tapping out with someone else, but like actually going through the motion with them and processing afterwards. I feel like that within itself is very impactful in the work that I do with trauma in my students. Because I feel like a lot of these students, they push away or they don't have that healthy relationship, and just feeling comforted and knowing that, you know, this person isn't going to leave me no matter how hard I push them away. They're going to stay. I feel like it creates a sense of like a safety net that can really be instrumental when building a relationship with students who have experienced trauma.
Thank you, Daisy. Yes, many good things in what you said. I want to just put one little caveat. You said not tap out. The only time I would tap out is if I was losing it. If somehow I had gotten stuck in a power struggle with somebody, or I was getting too upset or something like that, then I would welcome someone else to take over and step back and calm myself down. The other thing I wanted to say is one of the things that is essential to forming a real relationship, and I think you alluded to this, Daisy, is to believe in your heart that take, for example, their guardedness, that the wall that they built up has been for survival, that it's something to respect. If you met a person who's having difficulty letting anyone in or trusting anybody, the worst thing to do would be to say, well, let's beat down that wall and make them let people in. That wall has saved their life. And so you want to respect it, explore it, understand how important it's been, and see if they would be willing to open a window. The more you have that deep in your heart that they're behaviors and symptoms served a purpose for them, the more you'll be able to stay with them. And Crystal, you're right about building trust, and boundaries will be trust tested. Anyone else want to add anything on following relationships, Carol? Excellent. One thing I hate about people, first of all, we should say that the words we use to talk about our clients and to talk about their behaviors are very important, because the words we use to the actions we take. So sometimes people describe the process you were describing, Carolyn, as they're on their honeymoon and now their real self is coming out. Well, actually, the way they were at first is part of their real self. They are at second is part of their real self. It's all their real self. It's just like saying, implying that the good part is fake and the real self is the bad behaviors. I like that you said when they trust you enough to show you what they're struggling with. All right. So then Josephine, what would you like to add?
I was just going to say, for when I do my trauma assessment, I'm only allotted 10 minutes in a room for my social service initial history and the trauma assessment. And the fact that I have to ask 15 trauma questions and my social history in that time is absurd. But
yes, it is.
That's how our billing is done. So I find that people don't want to answer the questions appropriately. They're like, no, that didn't happen. Nope, nope, nope. So if I get some kind of inclination that something did happen, or if I notice body language, anything, then I go back when it's non-billable hours and I try to ask again just so I can get a good treatment plan or a care plan in place. But trauma-informed care in my company is new, so they don't understand that we need more than 10 minutes to conduct something that in-depth.
Well, you're absolutely right, Josephine. That is ridiculous. And I think what you're doing that's great is you're not blaming the client. Like a person might say, these clients, they'll never tell you what happened to them. They're liars. Instead, you understand what that would be like to have someone say, hi, nice to meet you. Now tell me your whole history. And by the way, did anybody ever sexually abuse you? And it's something wrong with the process, not something wrong with the clients.
Absolutely.
As you can tell from the way I'm talking, a key factor, a key component of trauma-informed care is that you consider that what has happened to someone in the past affects their present. And so in order to understand someone, you have to understand what has happened in their past. And if it's a team effort, like a special school or a residential or a group home or something like that, everyone in the team should know what's happened to this client, because for one thing, it builds our compassion and helps our compassion through, helps us stay compassionate even though the behaviors are difficult to manage. Plus, it's important for us to make that line between this is what happened and that is why they're behaving this way. It helps us make sense of behaviors that seem bizarre. So some questions that can help us understand the past is about to look at someone's experiences and what would you learn about, if you had those experiences, what would your assumptions be about other people? So if a kid has been moved 5 times to different foster homes, one of the things they've learned is that other people leave you and really are interchangeable, that one person is just as good as another person. They're all about the same, and so don't get attached to any of them. And then we want to think about, given what happened to this child and when, and by the way, this analysis is just as relevant to an adult if you're working with an adult, but you're looking at their past. So what biological changes might we reasonably expect to have happened given what happened to them and at what age? So for example, if we know that the person grew up in a household of great domestic violence, we would expect their body to have made some have changed because they were constantly in a feeling of danger, that any moment they or someone else might be killed. So we would expect them to be hyper reactive, unable to sleep, unable to concentrate, always jittery, always afraid that someone bad was coming along all the time. So given what we know about the body and its reaction to different traumas, we want to think about, so how is their body as a result of what has happened to them? Looking at that polyvagal ladder I told you, remember that the body's perception of danger changes through experience. So what has this child learned is dangerous? Have they learned that men are dangerous? Have they learned that nighttime is dangerous? Have they learned that eating is not guaranteed? And then we want to look at if they've experienced racism or community violence or community distress. What have they learned about themselves? Have they been basically taught that they're no good because they're of a certain race or something? So all this stuff leads to how this body experiences safety and danger. And therefore, they bring that to your setting. And they have the things that are particularly upsetting to them that they don't understand. You might not understand why, but it's because that thing has been associated with danger in the past. But equally, we also want to learn and think about and respect what skills has this person used to survive. This person is alive, they're with you, and sometimes they have amazing good qualities. They are willing to try again with caring about people, etc. And that's because they've learned skills. They've learned how to survive. And what has been helpful to them to survive, that individual. For instance, one individual might have learned how to dissociate, how to space out from a problem in order to not have it hurt as much. And they were going to do that still because it worked for them. Another one, as we were talking about, might have learned not to care about anybody, that there's an armor. Another one might have learned to be, and because they were hurt when they were small and they were very vulnerable, that their smallness and vulnerability led to great pain. They may have learned to be aggressive and angry to feel powerful. So we want to think about what skills has this person learned. We also want to think about what skills haven't they learned, because that's going to be our job to teach them the skills that they've missed. Because we understand that things like managing your feelings and feeling worthwhile and making connections and keeping them aren't things you're born with. They're things you're taught by your caretakers. And so this particular person may not have learned how to identify feelings in their own body, especially when they're small. They may not know words to put to feelings. Maybe the only word they know is anger. They may not know any techniques to calm themselves down. There's our work cut out for us to teach them that deliberately and carefully in many different modalities, both by active discussion, by visuals, and by what we do, by modeling what we do. So doing this deliberately, and guess what? It takes more than 10 minutes. This kind of analysis we're talking about now is why a good trauma treatment needs time to think, to stop and think. How do I understand this client? Why do I think they're acting the way they are? And what do I think they'll need to in order to learn how to meet their needs without hurting others? It's also good to have a chance to talk this out with others, like other members of your team or your supervisor, to talk out questions about a certain child with other people, because then you can figure these things out yourselves. So good trauma treatment needs time. The practitioner needs time to reflect. So what do you think about this? Any comments or thoughts or questions about this kind of consideration of someone?
So sitting here, like listening to all this is kind of like, it's kind of like allowing me to have a trauma lens, like looking at the people around me, and it's like, okay, so that kind of explains their behavior in this situation, and that kind of explains in this situation, not to diagnose necessarily, but kind of looking at and understanding behavior.
Right, good. That's exactly the point, that you, if you use this kind of a lens, that the behavior begins to make sense and you begin to respect it, even even as you understand that if the person's going to have a life worth living, they need to learn some more skills. Any other reaction to this way of thinking about it? This is what one of the assignments was, to think this way about someone, whether it be Kevin in the video or whether it be okay. So we've started by looking at how the past has affected this person. Now what we want to look at is an individual problem or symptom that that person is showing. And this is the phrase symptoms or adaptations, which is a key phrase in trauma-informed care. So we have an idea, we have a basic understanding that any way someone's acting is solving a problem for them, and that they're not going to act any differently until they learn a better way to solve that same problem. If I'm in I travel, or when we used to travel, I travel a lot for training. And if I'm in Utah and I'm feeling lonely and I'm in a hotel room, I go downstairs to the hotel gift store and buy 2 packages of cookies and eat them all up. I feel immediately much better. But then I go home and someone explains to me why this is a bad idea. So then I decide, okay, I'm never going to do that again. Do you feel hopeful that I'm going to change?
You'll probably change your behavior. So you may not eat cookies, but you might do something else.
If I did want to change, what would I have to pay attention to? I said something about why I ate the cookies. What would I have to pay attention to? Yeah, the feeling that triggered it. I said I was lonely. So, and this is a very simplistic example, that if I begin, where I'd have to begin is that the feelings, the behavior might not make sense or might not be good for me, but the feelings are real and they do make sense. I'd have to act on a level of what else could I do that would help me feel better? And could I call someone? Could I connect with someone at the place? Could I do this? Could I do that? It would be through treating the underlying meaning of the behavior that any change would be possible. It wouldn't really help to bring a bag of baby carrots if I didn't pay attention to what was the meaning of the behavior beneath the behavior. However, it's not always easy to figure out a behavior. It's not always obvious when you see someone doing something. It's not obvious why such a harmful, hurtful, either hurting themselves, hurting others, things that get them bad consequences. How could this be a good thing? How could this be helping them? So how do you get a sense of that? Well, first of all, you look for the patterns. When does this behavior happen? Now, if you talk to someone, let's just say you're in a school and a kid is referred to you because they're always having temper tantrums and starting to yell and throw things. If you say to someone, well, when does this happen? Say to his teacher, let's say. The teacher would probably say, always. Whenever anyone says no to him, it happens. Well, actually, nothing happens all the time. So you ask more questions. Well, does it really happen all the time? Are there any subjects that it doesn't happen? Does it happen to gym as much? How about lunch? Is it more or less there? Does it matter who the staff is that he's talking with? Does it matter whether there's other kids around? Is it like happening right before lunch all the time? So we might figure maybe he's hungry. So you look at, when does it happen? What are the circumstances? What are the people around them? What are things like, did they get a good night's sleep the night before? Things what's happening in their home, if they're living in a home, etc. Non-judgmentally, you're just trying to figure out the patterns of this behavior. and getting beyond the idea that it happens all. And then you look at what changes, what actually occurs after the client does this behavior. So let's just say you have a kid who always starts throwing books around and yelling in math class, and you look at, so what happens after he does that? Well, he gets kicked out of math. And so what does that accomplish? Well, he never does have to do his math assignment. I'm giving you sort of simple examples. It's not that simple, but anyway, you get the idea this way. He never has to do his math. And in fact, as you look at it further, you find out that he doesn't know how to do math, that nobody ever taught him, that he feels like a stupid fool. He's afraid to ask questions or admit that he doesn't know this because he thinks it means he's completely stupid. And so he's found a very effective means of getting out of doing math. Of course, it has some long-term bad consequences. If you go through that sort of analysis, you have a whole different approach to what to do about it than you would if you didn't do that analysis. If you didn't do that analysis, you'd think, well, this kid is just defiant and doesn't like authority, so I'm going to punish him and give him some kind of consequence for this. Or maybe if you were feeling particularly benevolent, you could say, well, I'm going to give him a reward every time he goes through a day and doesn't do this. But after you've done that analysis, your thoughts about what to do to help would be more like, well, I wonder if I could get him a tutor. I wonder if he could do his math in private without anybody having to observe whether he's doing what he's doing or what he knows or what he doesn't know. I wonder if there's some way we could, without hurting his pride, start teaching him some of the early basics. So you see how analyzing the behavior just sets you in a different direction for interventions. Like when I used to work in residential, if a kid had always had problems at bedtime, they wouldn't go to bed. They were always talking and making noise and stuff at bedtime. Our previous long time ago response would have been to give them an earlier bedtime. That's really helpful. Now what we would do is think, well, why is it hard for this kid to go to bed? Maybe it feels scary and vulnerable. Maybe they were hurt at night, or even if they weren't hurt at night, when the quiet of night comes, all their bad thoughts come to them. So then we're thinking more about how can we support them in falling asleep? Can we read to them? Can we have a nightlight? Can they listen to music? And that after a while, when they do this, they'll be able to get to sleep without these props. But at the beginning, they're going to need help getting to sleep. So you want to look at what gets better after this behavior. In what way does the client feel or do better after the behavior? If the client's feeling small and weak and they act all mean and bad, now they're feeling powerful and strong. You also look at any times when the behavior doesn't happen. Maybe there's a certain staff that the client never does this with, or a certain time of day, or in a certain subject, if it's school, and you build on that. And with all of this, you then think, what skills would help this client do better? So if you go back to the math example, one skill would be to have somebody kindly and thoughtfully teach him math. Another skill would be, how can he begin to trust his teacher enough that he can tell her if he's having trouble? So how could we build that skill? You want to be very specific about what skills would help this person meet those same needs in a way that doesn't hurt them and others, because the needs are legitimate. We're starting there. So how do you like this idea of this way to look at a problem behavior? I want to add that what you don't do is say to the kid or client, why do you act this way? But what you can do is say to the client things like, what was happening for you right before this happened? What was happening afterwards? More of an exploring. I've seen both good and bad examples of functional behavior analysis. Like, it's not really analysis to say, well, the kid wants attention. We could say that about anybody all the time, so that's not that helpful. So this is a very important analysis. Again, a good thing is to do it with a team if there's a team working with the client, because people will observe different things. Like one person will say, well, he always acts this way, and another person will say, I've seen him do that. He never does that when he's in my class. Well, what's the difference? There's lots of possibilities of what the difference is. So these are good questions to do as a team. So here's probably one of the most, yes, it's interesting, Crystal, you say building skill sets for the individual. You can go through some of this with the client because you're helping the client learn to analyze themselves, to try to understand themselves. And again, you're giving the client a different message than they've ever gotten. They've usually gotten a message of, why are you doing all these horrible things? Instead, you're giving them a message of, let's see how this works for you. And then you want to stay there and not try to change it. Another thing this relates to is motivational interviewing. I know that's taught in quite a few classes at USJ, so you may have learned about that. And motivational interviewing is totally on the idea of staying where the client is and learning what to the client feel like the pros and cons of what they're doing. All right, so if there's anything I'd like you to learn from this class, it's the idea that in order to try, if you try to change someone, you will push them more into their behavior. That before, there's a lot of pressure on us to fix our clients, whether it be from their families, from the payor, the insurance company or something, from our fellow staff members who are tired of their acting up. But the more you try to change someone, the more you push them into where they are. So let me just give you an example. Supposing you said to a kid, well, we're going to have a family meeting with you and your mom. And the kid says, I'm not going to meet with my mom. I'm not going to have a family meeting. I hate family meetings. I'm not coming. If you say, well, it's an important part of your treatment, you have to come, you're required to come. And the kid will say, no, I'm not, so you can make me. And you'll say, well, we'll take away these points and do this and do that. And they'll say, so what? I'm not coming. And the more you push them, the more entrenched they'll get in their position. On the other hand, if the client said, I'm not coming to family meeting, I hate it. And you, of course, one thing to do would be to say, why? What don't you like about it? What's bad about it? Then after you explore that, you could say, you know, maybe you're not ready for family meeting. You're right. It may not be the right time for you. Maybe I should just meet with your mother alone and do that for a while till we think you're ready for it. It's quite possible that at that point a client would say, what are you talking about? I'll come. I'm going to come. I'm not going to meet with your mother alone. Or they might not, but that's fine. As you've stepped away from fighting with them, as you aren't pushing against them, that gives them space to change their mind or to open up or to tell you what's wrong. Maybe if you don't say you must do it, instead say what don't you like about it. They might say, well, my mother always says mean things about me in these family meetings or something. There's probably some very good reason why they don't want to go to a family meeting. So if you push hard, you're making the person stronger in their opinions. If you stand beside them on their side, they have room to move to another side. Right, exactly, Crystal. I'm going to ask you, well, we'll finish this, and I'm going to ask you to explore this. So what you should do much longer than you think you should, much before you try to change anything, before you try to give advice, fix it, is explore it. And I have the pictures here of self-harm because that would be an example. you don't say, okay, somebody's cutting themselves. Well, let's talk about how you could stop. First, before you say that, you say, tell me more about it. When do you do it? How do you do it? What does it feel like beforehand? What builds up to it? What does it feel like after doing it? What does it feel like afterwards? How do you think people react to you doing this, etc. So you begin to learn about this behavior and helping them to learn about it long before you try to change it. And I mean that you really are asking them to explore it. You're not just waiting for a time to jump in and tell them to do it differently. So if somebody, if you're talking about self-harm again, and if you're saying, well, what do you feel when you're just about to do it? And they say, I feel an incredible amount of tension. And you say, well, what are other things you could do for that tension? You're immediately moving into change mode. And in every change sentence, there's a underlying meaning that you're not all right the way you are. But if you believe in your heart that this person learned to cut themselves as a way to survive, that it helped them not to stab others, for example, or it helped them to deal with overwhelming pain and find a way to take control of that pain, you know that you're not going to jump there and say, well, do something completely different. So I have a couple of ways to explain this to you. Which are easier to do in person, but I'll do them. I'll do one now and see how it works out virtually. Have any of you ever experienced stress at work? Let's just do the emoticons or raise your hand or something if you've experienced stress. All right. Now, have you ever, I'm not going to ask you how, but have you ever dealt with your stress at work in a less than perfectly healthy way? And by work, let's include graduate school. Have you ever dealt with the stress of being in jobs in graduate school in an epidemic, virus epidemic, in any way that's less than healthy, such as overeating or drinking or overspending or any of the many ways that there could be? All right. Well, luckily for you, USJ has thought of a great new program, and that program is that they've brought hundreds of little cameras, and they're going to put a camera on you everywhere you go, and they're going to monitor whether you're doing this thing that's unhealthy to manage your stress. And if you don't do it for a whole week, they're going to give you $100. But if you do it, unfortunately, you're going to have to pay them $100. And this is, of course, to help you, because if you could not do this unhealthy thing, it would be better for you. So this is all for your own good, this wonderful new program. So who wants to participate in the program? Jamie, I saw you had your hand up before I said that. So what did you want to add?
Oh, no, I was just raising my hand when you asked the question if we've been stressed at work.
Yeah, good. So would you participate in this program with the little cameras? But this is for your own good. Okay, so always one who would. What would be some of your concerns about participating in it? What would be some of the things that would hold you back from participating? Anna?
I'm already stressed. I feel like it would be an additional stressor to have someone monitoring me.
An additional stressor to have someone monitoring you. What about the privacy? Who's looking at these videos? Charisma, also true about the stressor. Any other things people could think of as reasons not to participate?
I feel like the feeling like judgment, also like kind of invasive. I pride myself on privacy, and so just having someone looking in and pointing certain things out, I think that would be like, and I said like it would be anxiety producing.
Right. would be a judgment, anxiety producing. Somebody might think that they would probably fail. So they'd probably end up owing the $100 every week, right? You could be afraid of that. Furthermore, there's this. What about the fact that you don't actually want to give up that unhealthy? That it helps you, that you don't want to stop doing whatever it is that you know perfectly well is unhealthy. You still don't want to stop doing it because you need it right now. It's your way of getting through a very stressful time. And that's exactly what I'm doing in this program, which, by the way, I made up. It's not true. Is exactly what we often do to kids. We watch them all the time, grade them, judge them on their behaviors, assume they should give up things that we decide are not healthy, and then we think we're going to reward them and punish them into doing so. We don't like it, and they wouldn't like it. They don't like it because the message in there is you are not all right the way you are. So I heard a wonderful thing about this. You know how sometimes you can see a picture like of how a butterfly comes out of a caterpillar, and we can say, oh, don't worry if you're a caterpillar, you'll become a butterfly or something like that. How about who loves the caterpillar? Who loves the caterpillar while they're a caterpillar before they turn into the butterfly? It's by loving that caterpillar just as they are as a great caterpillar that they can even become a butterfly. So when we push some change, we're saying you're not okay the way you are. What we ideally would give someone the message, everything about you makes sense and was your body's strength to protect you through something that was unbearable. It may not be working for you now, and we can help figure out other ways it could work for you. But we together respect the way you've become now. The more you can have that in your heart, even if you don't always do it, if you come from that premise, it helps. It doesn't mean that you never talk to anyone about changing. You have to do that. That's where you are, where you get to. You just don't start there. You move on to change once the person has really felt understood and loved or liked or respected, might be a good word, where they are now. So we want to help people move forward by actually teaching them skills, and we'd have to think about what actually teaches these skills. How do you learn feelings management? You learn it things like feelings chart. You learn it every time we say, take a deep breath, come for a walk with me. You learn it when I say, oh, I'm getting upset, I'm going to take a few deep breaths. You learn it from watching how we staff interact with each other. You learn it by practicing. You learn it by making mistakes and trying again. So we want to be deliberate about how to teach this kid these skills that will help them. And, you have to be safe to be able to learn. Is there anyone in this class who's ever tried to learn something and that you wanted to learn and hasn't been able to? I mean, something like knitting or speaking a new language or rollerblading. And what sort of thing did you try to learn?
I flunked Spanish in high school.
Okay, so would you be willing to play along with me on this for a few minutes?
Sure.
So Anna, do you understand that your worth as a social worker would be much better if you spoke Spanish and you could get a higher salary and help more people? Learning Spanish would be very good for you.
Yes, I'm aware.
So we're going to, your treatment team, because we know this is what's right for you, it has come up with a great plan. We're going to speak to you in Spanish, and if you speak back to us and say the right sorts of things to speak Spanish, we're going to give you $200. But if you insist on resisting and refusing to speak Spanish to us, when you know perfectly well your life would be better if you spoke Spanish, then unfortunately you're going to have to stay in your room. Now, is this helping her?
No.
What if so you seem to be a very difficult client and particularly resistant. So your treatment team has decided to up the stakes and give you $400 if you'll just have a conversation with us in Spanish. Have we explained to you how important Spanish is for a social worker? If you'll do that, we'll give you more. And if you don't do it, unfortunately, you're going to have to stay in your room for a week because you're being so stubborn. Is that made it more likely by upping the punishments and rewards that she'll do the new thing?
No.
No, it's made it less likely because now she has extra attention. The fact is, what would she need if Anna really decided that as an adult that she wanted to learn Spanish? What would she need? Anna, what would you think you would need if you decided as an adult to learn Spanish? Support?
Yeah. Self-motivation?
Mm-hmm. A tutor. Yes, self-motivation, a tutor. Exactly. A kind tutor. A tutor that was going to teach her a lot of little things, because we often just order people to do things that they don't have the skills to do. And skills are not helped by punishments and rewards. They're helped by teaching, by somebody teaching you first the small Spanish words and then the grammar of Spanish and the gender and things like that, and then gradually more complicated things and so forth. Small that build up to big steps. That's how you learn a new skill. And yes, the first time the tutor said, "You seem slow in learning this, Anna," then she'd be out of there, like, forget Spanish. Maybe I could learn sign language. So it's that's what we need to do, not try to order someone to be different or punish them if they're not different, or reward them, tell them that they can get rewards if they are different. Like if somebody said to you, "We'll double your salary if you'll fly to work on your own wings." That wouldn't help you to do it. So, Carolyn?
I would add too that like not only do you need like one-on-one support and encouragement, but also sometimes people need to just accept that it's not something someone can do.
Right.
And not everyone's going to be able to meet all expectations, and sometimes the expectation itself needs to change.
It's a very good point, and not everyone has to speak Spanish. Great, very good point. Another point to trauma-informed care is the idea that we, of course, have to consider the person's current environment and family, especially for a child, that what is their current life like? We can't be working with a child on emotion management if they're living in a situation of domestic violence. What about their community? You know, are we mad at a kid who is to school late but in order to get to school, he had to go on a roundabout route to avoid a gang that was in a certain place in his community? What about racism? Is this kid dealing with racial discrimination at the moment? Are racial factors influencing his family at the moment? So, in other words, don't see people in a vacuum. And this is something I think social work is good at. We have the whole biopsychosocial viewpoint that a person is not on themselves on an island, that what's happening to them is affected by what's happening around them. So I already told you this stuff. And just a couple other things is that to remember, and I think this will especially apply to your autistic kids, but to all kids, to all people, to remember that just stimulation can be upsetting, just confusion, just the number of stimuluses around you, even if it's for a good reason, like this is when we didn't have advice, going to a amusement park, that something that's a treat, but that has a lot of stimulation, a lot of noise and movement and so forth, can dysregulate somebody. I was consulting recently to a group that took the kid bumper cars, and one of them just had a complete meltdown. And it was just really the stimulation. So much stimulation made their body crazy. And also remember to look for whether the person is feeling powerless and vulnerable and small. Our kids, our people we work with, have been hurt when they're powerless. When they've been powerless and small, someone has hurt them badly. So they react strongly to feel powerless and small, and sometimes even to seeing other people be powerless and small. So that times when they feel powerless and vulnerable are times when they might act aggressive, try to puff up. And so that's one of the things to look for in terms when you're trying to understand a behavior, understand why is this happening? Why is this person doing this? So again, we're looking at what skills will this person need to do to reach. So if you have someone that's reacting to feeling powerless and small, what are some positive ways that they can get power, have power? Can they teach something to a younger kid? Can they be in control of the afternoon activity? And they help the staff do the chore list? Can they help the teacher design the assignments? So what positive ways are there for them to feel powerful? The same goal, but with a different way of reaching it. Okay, so as usual, I want to do more than I can fit in. And I like the discussions. I think they're more important. So I'd like us to, a little bit for next week, we'll maybe practice about what our change, what type of things do we do and say with people that are exploring strategies, and which type of things are change strategies. We as I said before, I just want to mention, we need both. We change strategies and we need explore strategies, but we jump too fast to change strategies. So I'm going to ask you to do a little